India is on high alert over a sharp rise in H1N1 virus cases. Delhi alone has reported over 2,300 Influenza-A cases this year, with more than 1,777 of them confirmed as H1N1. In the last 1 week, 70% of all respiratory infections tested in the capital were H1N1. Hospitals in Bengaluru and Kolkata are also seeing more patients with high fever, cough and body ache. So what exactly is this virus? How dangerous is it? And should you worry? Let's connect the dots. So what is H1N1? H1N1 is commonly called swine flu. It is a respiratory infection caused by Influenza-A virus. It was first called swine flu because it was similar to flu viruses found in pigs, but today it spreads only from one person to another. You do not get it from pork or from pigs.
So when we say H1N1, what we mean is that it's one of the strains of influenza. So influenza is a very common respiratory virus classified into type A and type B, and then further subclassified based on some of the antigens. So the H and the N, they both stand for hemagglutinin and neuraminidase, which are antigens that the influenza virus has on its surface. And there is a numbering system. So when we say H1N1, we're referring to, it's also commonly called swine flu, but it was the virus that actually caused a pandemic in 2009, that WHO had declared an influenza pandemic.
For most healthy adults, H1N1 is self-limiting, which means it gets better with rest and proper care in a few days. But for some people, it can become severe and lead to hospitalization. The virus behind the current surge is not new. According to the Indian Council of Medical Research or ICMR, it is the A/Missouri/11/2025 H1N1 PDM09-like strain, which has been in circulation since 2025. There is no new mutation, and this strain matches perfectly with the current flu vaccine. So how does it spread and what are the symptoms? H1N1 spreads very fast. When an infected person talks, coughs or sneezes, tiny droplets carrying the virus go into the air. If you breathe them in, you can get infected. The virus can also survive for a short time on surfaces like tables, doorknobs and phones. If you touch a contaminated surface and then touch your eyes, nose or mouth, it enters your body. The symptoms are very similar to regular flu and COVID, so testing is needed to be sure.
The symptoms of influenza, as we all know, fever, body ache, sore throat, cough, fatigue, and so on. And most people, the symptoms last for a few days, maybe up to a week, and then the person recovers. But there are some people who are more prone to developing complications like pneumonia. And those are the elderly, children, especially under the age of 5, pregnant women, and those who have underlying chronic illnesses like autoimmune diseases or underlying respiratory or cardiac illness. These people are always more susceptible to developing a complication. So essentially, if it's just a fever, cough, sore throat, body ache, headache, one can take rest, take paracetamol, take a lot of fluids, stay at home.
Doctors say you should go to a hospital immediately if you have warning signs like shortness of breath, chest pain, persistent dizziness, high fever that does not come down, or severe dehydration.
If you start getting symptoms like breathlessness, not being able to breathe very well, or the lips and the nails are turning slightly blue, or you're not able to eat and drink properly, or you're feeling, that you are not, fully able to concentrate and there is any kind of change in the consciousness. And in the case of children, continuous crying, irritability, vomiting, and so on, and not feeling well, These are kind of danger signs, including, a rapid breathing rate. And these are warning signs, and such people should be taken to the hospital because they may require to be admitted, to be given oxygen and some other symptomatic treatment till they recover.
Now the question is, why is there a surge in H1N1 cases in India? There are primarily two reasons. First, seasonal change. Monsoon, humidity and temperature fluctuations help flu viruses survive longer. Second, crowding. When people stay indoors in close contact, the virus spreads more easily. This happens almost every year. Delhi has seen such spikes in the last 4 to 5 weeks. The good news is that ICMR data shows numbers have slowly started coming down in the last 2 weeks. So how serious is the infection? For most people, no, it is not life-threatening. But the government of India is taking it seriously to protect vulnerable groups. After reviewing the situation, Union Health Minister J.P. Nadda and state health authorities have put a whole-of-government plan in place. ICMR has said clearly that no new strain of H1N1 has been identified and there is no cause for panic. The influenza strains currently circulating are also well matched with the vaccine strains. Hospitals across the country have been told to scale up screening for influenza-like illness and severe acute respiratory infections. India's Health Ministry has audited isolation beds, oxygen support, ventilators and antiviral medicines in all government hospitals. Medical staff are being retrained for early detection and home care. Local municipal bodies are running awareness drives in OPDs and public spaces, telling people not to self-medicate with antibiotics. The Delhi government has also issued a public advisory asking people to follow respiratory hygiene, avoid crowded places and seek timely medical advice. Now, prevention is simple and effective. Get your annual flu vaccine. Wash your hands frequently with soap or use a sanitizer. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Stay away from people who have flu symptoms. If you have fever and cough, isolate yourself at home. Doctors warn against taking random antibiotics or over-the-counter flu pills without a prescription. Rest, hydration and timely antiviral medicines like Oseltamivir, if prescribed early by a doctor, work best. India is not alone. Surveillance by the Pan American Health Organization shows H1N1 remains the dominant strain across the Caribbean and Central America. Zimbabwe reported nearly 12,000 weekly cases of mixed influenza-A and B due to a cold spell. In the United States and Canada, H1N1 is present along with a rise in H3N2 flu. Now let's check the history of H1N1. The first global outbreak of this virus happened in Veracruz, Mexico in March-April 2009. Scientists found it was a triple recombinant virus with genes from human, swine and avian flu viruses combined. It initially jumped from pigs to humans and then spread worldwide through air travel. Since then, it has become a part of our seasonal flu cycle. So by staying aware, following basic precautions and consulting a doctor when needed, one can easily keep himself and the community safe. That's all in this edition of Connecting the Dots. We'll see you in the next episode with more raging issues. Until then, it's a goodbye from all of us in the Delhi newsroom. This is Munmun Bhattacharya signing off. Take care and stay safe.